Are you allergic to any topical preps?
No.
Okay. All right.
See, you ought to do like what my dentist does. She gives you a lidocaine, so you don't feel it. Because actually the stick is the worst part.
Oh, by far. Actually, when I trained with Charlie, he actually made the comment that he was trying to figure out ways to get less sensitivity for the polymer things, and at the time he was using this sterile vibrating stick to try to desensitize the nerve endings.
Yeah.
And in the end, he felt that really didn't work. And there are a whole bunch of topicals that have been tried, but the glabrous skin of the palm is impenetrable by them.
And skin generally, I remember when I broke my elbow 20 years ago, and the worst part, because I wanted to see, I was even awake for that surgery. And the worst part of that surgery is when they stitch you up at the end.
Okay, so keep your hand up like that.
Okay.
Perfect.
I felt like he was putting his foot on where the stitches were and then pulling the ends to make it tight. That's how it felt to me.
That probably is what he was doing. So now when we do this, you're going to be a helper in 3 ways.
Okay.
The first way is I put some numbing medicine in, and at times I might ask you if the pad of your fingers is feeling numb.
Yep.
The second way that you help me is...
As if there's any zingers.
Well, that's the third way. That's the last one. The second way you help me is at times I might ask you to gently bend the tips of your fingers.
Sure.
I don't want full fist making. I just want tip bend.
Okay.
All right. And the third and most important is, as you know, I'm going to be working near those nerves, and if I get to a spot where the nerve crosses
I'll let you know.
over, it's an electric shock. It's not like maybe I feel a little something. It's a impressive zing that you will feel. And I make a mental note of that spot, and I work above and below that spot.
When we do our virtual phone consultation, I'll get to see your face.
Yeah, or you can look at the video of me doing this, and there I am without a mask. All right.
I still think you're very young to be doing this.
Nice. To be doing this, that's funny. All right.
So how many does this make for you?
I don't know. I've never counted them.
So how many a week do you do?
It depends. I'll do anywhere between 1 and 4 in a week or thereabouts.
Well, okay, so let's assume you do 3 a week times whatever that is. Let's just do the math.
Yeah, if you do rough math, I think it's been a lot since I've been doing them for a while.
How many years?
I think 15 years ago I started.
Oh my God!
So it's
you were just a child.
Yeah, you're funny. All right. So.
Can you do this upside down?
What do you mean?
Backwards.
Well,
backwards.
Well, there's no doubt you are, because you don't want to lie down, you are changing my angle a little bit. But as a surgeon, I'm used to working from both sides of the table, so I will do fine.
Did you have a chance to watch my video?
I did. Yeah.
Did you like it?
It was really long, so I didn't watch it. I'll be honest, I didn't watch the whole thing, but I got through much of it. It was very interesting.
Wasn't he good?
All these things you pick up. Well, I'll tell you, there are many things I would do different. And you'll see those things today. Okay. So turn your hand even more palm up. That's perfect. And just use a roll towel.
He made me lay down.
What? He did?
Yeah. Well, that's only because I didn't know any better.
Okay.
And I was a lot younger then, so.
All right. So long finger, I just want to feel.
Do you like doing this?
Yeah, these are good for me. It's gratifying.
What's the most enjoyable procedure you do?
Oh, most enjoyable distal radius fractures. It's because you see they're fractured into so many pieces, all apart, and then you put people back together in a way that. All right, you ready for numbing medicine?
Sure.
Sorry for the discomfort.
That's what they always say.
Do they? Ouch.
You're better than most.
I don't know what size needles they use.
46.
Ready? Needle stick up here. Sorry.
Yeah.
Ouch.
That's not bad.
You're nice. People say otherwise.
You want to hear about my cracked radial head?
Did that hurt?
A little bit. because I tend to get hurt when I'm not looking where I'm going. So I had been running across the street right in downtown Chicago.
Can we do this, though? Can story continue after I'm...
Sure.
Perfect, thanks.
Sorry.
No, it doesn't
You
distract...
let me know when.
It doesn't distract me. I want you not to be distracted so
Okay.
that... needle poke, you'll feel still a little bit, even though I put numbing medicine in, because I just put a little bit right at the surface. Now I'm just coming across it. You're going to feel a little grating. Do you feel that inside?
Yeah, I like it.
You're a glutton.
Didn't you hear what I said in that video?
I don't know. I heard a lot. You guys talked a lot.
I said it feels better than sex.
I definitely did not get to that
No, you
part
need
of
to
it.
get to that part. It's quite good.
So the biggest difference I noticed in technique is I just numb the very surface of the skin,
Okay.
and then I do my work in a way that you will still feel what I'm doing.
Oh, I like what you're doing.
The difference is he actually started in the palm and injected deeply on both sides of the tendon
Okay.
in a way that is totally going to then numb your nerves.
Okay.
So the problem is you lose that protective...
The feeling.
exactly.
Yeah, mhm.
So I begin, as you see here, most distally where the nerve is, and then I will slowly move proximally.
Okay.
When I worked with Charlie, what was interesting is he did this sort of sewing needle. You feel that?
No.
Where he goes up and down in the cord, and there's no doubt I do what they call the pendulum technique,
Okay.
where you go side
Back
to
and
side.
forth. You see, it's the swipe technique.
Or swipe, is that what you call it?
Yeah.
Excellent.
I tried to have my doctor, my regular doctor, do this on me, and all he did was poke at it. And I said, you didn't watch my video. They don't poke at it. They swipe.
Well, Charlie was a poker when I watched him do it.
I don't like poking.
Yeah.
I like what you're doing better. Sorry.
It lets me control
Sorry,
the
Charlie.
depth. That's probably the one thing that I would say, because many of the things that I'm doing, the size needle that I'm picking, and many other things are straight takeaways from him. The biggest difference was the technique of back and forth.
What gauge needle are you using?
25?
25.
Yeah. And that was actually, there you go. Did you feel the pop?
No.
And the finger come straighter?
No.
And there's another one. All right. So that was
Good.
just the release there. Hold on. I'm going to be pulling now.
Ow.
I know nobody likes that part.
Well, I figure you're a hand surgeon, so you're not going to break my finger.
Never have. But, you know, I can fix it if I break it. It's not
Is it
your-
covered under warranty?
Yeah, that's great.
Ah!
Yeah, see, now you're not going to show the video to anyone with the
No, I'm going to leave
with the
that in.
screaming. All right. So
I'll put a message that says, note the screaming in the next section.
so your cord is totally disrupted now. I do
Okay.
not feel it there at all.
Okay, cool.
So it's that is good. And now when I get you, I can actually get you all the way straight now, but it doesn't want to. You know, it wants to still be tight. So therapy is going to be splinting you to get a finger that has been crooked for a while, not crooked,
Okay.
because I do not feel anything left
Okay.
there. All right, so small finger done.
Yeah. Yeah, and you see that? It hardly bled. Do you see that?
Well, as it should be.
Yeah.
That's good, right?
Yeah.
Yeah. So I just go to the surface. I stay away from your artery as
Yeah.
much as I can. The other thing is I use lidocaine with epinephrine.
Okay.
So it used to be that you would never use epinephrine in the fingers. It was
Okay.
considered bad for circulation, but
Okay.
the Canadians actually were the ones who showed that it is perfectly fine to use low-dose epinephrine in the digits.
Okay.
So now this one we're just not going to get on that long finger that we're doing as much release just because there's not as
Okay.
much to release. Straighten your
Yeah.
fingers all the way out again. And was this the one that was injured when you were young or no?
No.
Why did I think that you had?
I don't know why you think that, but you can think that.
Yeah.
Here's a piece of anecdotal evidence for you.
Yeah.
You know, because I remember talking to Charlie about this too, and I said the only thing I can remember regarding my palm growing up is I played baseball, and I had good Rawlings gloves, but one of the things that most gloves don't have is padding in the palm.
Yeah, I guess not. They're just leather there.
It's just two pieces of leather. So when I played baseball and even just playing catch, I took a lot of shots in the palm. And I think that cells in the body, I could be wrong, I think they have memory.
Okay. Hold on 1 second, though. I'm doing the ring finger.
Yeah.
Okay, so the cord I can palpate is right there.
Okay.
Ouch.
Barely. Seriously, you're the best at this so far.
Yeah, I'll tell you, people with this needle stick say otherwise. They say that was really bad.
No. Nope.
All right, done there. And
I'm not adverse to, getting shots in my gums for dental drills either, so.
me, I just go for the drilling. Truly.
I have a good endodontist if you need one, and I'm not big on endodontists, believe me.
Thankfully, I haven't needed one.
Oh, good for you.
It's,
Excellent.
I crack a cusp sometimes if they don't take the bone out of the sausage of the pizza. I've done that twice. You ready?
Oh, yeah, I'm ready.
Little needle poke here.
Yeah.
Ouch.
Don't feel a thing.
All right. Keep that small finger just a little bit away from me. There you go. So I can
How's
get
that?
my finger in there. That's
Okay.
perfect.
So am I a good patient?
Yeah, it's,
I don't feel a thing. Are you even touching the cord?
yeah, I'm just to it now. Do you feel the little grating now as
Nope.
I come back and forth?
There, I felt that.
Yeah. That's
Felt
right.
that. Yep, that's good. That's good. Ooh. 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 Ooh, good one. Ooh. Oh man, that was great.
But I don't feel the release yet, so. And your
Ooh,
small
good
finger,
one.
I had to do 2 spots
Good
to get
one.
the release.
Good one. It's taken a long time for those fingers to get like that, so I'm not expecting a recurrence there.
Can you feel? Can I get the cord up there? Nope, it ends. So the biggest spot is right there. Ouch, sorry.
Nothing. Feel nothing.
Numbing Medicine wins again.
It's the touch of Dr. Watchmaker.
Kind. There we go.
Ooh.
So there it is.
Ooh.
All right.
That's a good one.
It is. You had a pretty well-defined cord there.
Ow!
Final bend. All right. So now straighten out as best you can.
That's great.
You are a star. All right.
That's
so
great.
the cortisone that we put in, if you know the data on that, they showed that if you put in a bit of cortisone, they actually, in the French video you showed me, I think based upon the appearance of the medicine in the syringe,
cortisone.
it was all mixed in with the lidocaine and the cortisone.
Yeah, okay.
They've shown that the recurrence, the fibrous formation may be delayed with the cortisone. So
Okay.
that is why I followed that advice.
Okay.
And Charlie did it as well, so I do everything Charlie does.
Oh, that just made my hand feel heavy.
And then I'm just going to be washing you up a little bit.
Any chance that we can just do a simple dressing?
Well, it's Band-Aids like Charlie does.
Band-Aids is good.
Yeah, Band-Aids.
I like Band-Aids.
Yeah, and if you're oozing a little bit beyond the Band-Aids, I put a little light roll, but it truly is just Band-Aid.
Yeah, perfect.
And hold on.
I'm happy if you are.
Yeah, no, this is perfect. This is...
Did you do good?
Yeah, this is how they go. You know, the PIP of the small finger you can't always predict because some of those, you feel like there's a definite cord there and it just won't give.
Yeah.
And, I still do enough full Dupuytren surgery. I've done 2 in the last week. And the biggest thing that I see there is that there are coming up the side of the small finger, the abductor to the small finger, the abductor digiti minimi.
Okay.
That muscle sometimes thickens
Okay.
in a way that I think it is very difficult with a needle
Isn't
to
that
always
cute?
release.
Look at how cute that is.
All right, that is all you need there.
Okay, you have a nice touch.
Thanks. And then I'll be measuring, because we measured before, so you put your elbow up, perfect, elbow
Like
down.
we're going to Indian
And up.
wrestle.
And then your MCP joint hyperextends 11 degrees and straighten up as best you can. Your PIP right now is at 18 degrees. So, hold on. Hyperextension of your MCP. And then
Did you have lunch today?
I did.
Good.
Hold on. What did I just say? Straighten up as best you can. PIP. You're sitting at 18 degrees about. And then the ring finger, you can hyperextend 4. And a true 0. Hyperextend. And then
That's very nice.
MCP ring. So it's a small ring. And then I take a look back